everyone. I'm excited. There is Nurses Week. I'm Nurse Edu, and I'm going to talk to us today about antibiotics abuse. First, I'll start by defining antibiotics, what it is, and also abuse, what it means in this context. Antibiotics are drugs that we use to treat bacterial infection. They can act either by inhibiting the growth of the bacteria or by killing the bacteria. Abuse in this context means improper use of antibiotics or the use of antibiotics without any medical justification. So when you take a drug that was not prescribed for you by a medical professional, or you take a drug that was prescribed for one thing and you're now using the drug to treat something else on your own, you're actually abusing this drug. Now, why do people abuse antibiotics? Bacterial infections are very common, and as we know, we use antibiotics to treat germs. People take these drugs on their own because of one, lack of funds for proper medical consultation. A lot of people complain that they cannot afford to pay for a doctor's consultation, so they just go over the counter and buy drugs according to what they feel or based on their past experience. Number two is distance. Some people have issues reaching the health facility because of their distance. They are always far, like where they stay is far from the hospital or any health center. Then thirdly, in emergency, or maybe if the condition becomes too critical, some people also want to alleviate the symptoms before getting to the hospital. Another reason why people abuse antibiotics is because of stigmatization, fear, anxiety. They are worried about their condition. What will people think of me? Oh, my condition is too bad, it's too critical. They are embarrassed. They don't want to talk to people about it because of that worry. So they rather prefer to hide it, go to the pharmacy or chemist and buy drugs over the counter to treat themselves. They might decide to go to hospital when the condition gets a bit better. Also, another reason is ignorance. Studies have shown that 40% of people who abuse antibiotics do not know that they are actually abusing antibiotics. What are the effects of this antibiotics abuse? When you take antibiotics that are not prescribed for you by a professional, there is a possibility that you may take too low a dose or too high a dose, and you may not even know the appropriate dose for your condition or for your age. And if you're taking excessive dose, you might tend to have exaggerated side effects like severe headache, dizziness, you might feel nauseated, have fever, convulsion, constipation, diarrhea, etc. Another effect of this antibiotics abuse is what is called antibiotics resistance. You can take a certain antibiotics and it gets to a point that the bacteria you're trying to fight in your body starts adapting to these drugs. The drugs no longer kill the bacteria. So you might be taking drugs and you realize that they are no longer working like they used to before. So this has been a problem. Then, above all, the most disastrous of these effects is death. You can actually kill yourself when you abuse certain antibiotics. Now, what are the remedies? What are the things we can do to curtail antibiotics abuse or put a stop to antibiotics abuse? Number one is sensitization, creating awareness. If we let people know that self-medication is not good, self-medication is harmful, because a lot of people do not know these things, it will go a long way to help. Secondly, we have to encourage these patients who always feel embarrassed coming to the hospitals or talking to health personnel to always be free-minded and open, because they are the reason these health professionals are there. Again, we have to encourage the government to erect health facilities in areas that do not have any, to overcome this barrier of distance. Thank you so much for having me, Health Circumference. I hope we are washing our hands, we are wearing our face mask when we are going out. I also hope we are observing social distancing outside there. I hope we are doing our best to stay safe. Happy Nurses Week.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation.